No cases of monkeypox have been recorded in this country, according to the National Institute of Communicable Diseases, NICD. On the 13th of May, the World Health Organization was informed of 2 cases of the disease in the UK, and since then, 15 countries have collectively reported more than 140 cases. The NICD says South Africans should report any illness or symptom to a healthcare professional because, as the world is well aware, infections in other parts of the globe can easily spread. Well, for more on this conversation then, I'm joined by the NICD Executive Director, Professor Adrian Puren. Prof, good evening. Thank you for joining me. So this situation with monkeypox, many of us didn't even know about the existence of monkeypox until a few days ago. And now we understand from the WHO that it has spread to about 15 countries. And my understanding is that there are endemic countries, and the concern is that it's spreading to non-endemic countries. Have we detected any cases of monkeypox in South Africa? Are we concerned about it spreading to this country?
Well, we have not reported any cases as yet, and I think it's just a matter of possibly time, perhaps, but let's hope that that does not happen, because, again, as you know, we've seen with COVID, we certainly have links to various countries, and so we can and possibly expect cases, but at this point we do not have any cases identified. And as you know, as you pointed out, monkeypox, and it's unfortunate that that's the term that we're currently using, but certainly was identified in monkeys. The first case was in 1970, if I recall correctly, of a child with this particular infection. And it has been endemic in the Western and Central Africa. And large numbers of cases very often can certainly occur. And I noticed that can reach even the thousands. There are 2 clades, as it's called, or strains of the monkeypox, and it's thought that the current outbreak, and I think what is unusual about this particular outbreak is the actual numbers of countries that have been affected, and actually the widespread nature and the numbers of cases that we are currently seeing. And that's really unusual. But it's thought that the virus has possibly not mutated to increase its transmissibility. But again, all these particular factors, I'm sure, are going to be, or facts are going to certainly be put together to give us a clearer picture of the epidemiology of this particular current outbreak in non-endemic countries.
I've just been seeing some of the communication that you've issued out in the last 24 to 48 hours around the vigilance and surveillance that I imagine has gone up. What do those measures include in terms of what healthcare professionals in various parts of South Africa, far-flung in the urban areas that are close to South Africa's borders with other countries in the Southern African region, and in particular countries that have perhaps a pathway to countries such as the DRC and linking all the way to South Africa via other countries? What are the instructions that you've issued for vigilance to be upped?
Yes, so the NICD does not issue vigilance. It's certainly assists with guidance, and so the port health authorities would be aware. Again, they have certainly screening procedures, and again, these can be effective possibly, but it's very difficult because in this particular instance, compared to COVID-19, the incubation period is fairly extensive and go up to 21 days. So again, even though you may have some screening tools which could be helpful to screen out individuals who may present with a temperature, for example, it's going to be really difficult. So I think it's really focusing within the country, for example, and individuals who have traveled to these particular countries presenting with specific signs and symptoms such as the acute headache and fever, but I think more pathognomonic, as we call it, with the very clear sign of an infection is really the actual rash in and of itself. And that will be a clear case where you need to then present yourself to exclude the possibility of having been exposed to an individual with monkeypox. I'd like to be clear that, again, this particular virus, as far as we are aware, is not efficient in terms of its transmission. And so we do not expect to see the large numbers of cases that we've seen with COVID. You really need close contact, and that means face-to-face contact, or even body or skin contact, broken skin, for example, or inhalation of, for example, droplets of this particular virus. So it's really inefficient. We do know that the case fatality rate is fairly low as well. But those are the sort of factors. I think it's really being clear around when you do present, if you have signs and symptoms as a result of your travel to those affected countries, then present yourself and have yourself tested in order to exclude this particular diagnosis.
So while you're talking about the ease of transmission or otherwise of this particular virus, Prof, you bring me to this point about whether or not there is a regional element in terms of its viability and transmission, the ease of transmission. Is it regional? Because I see that, currently the part of the main concern, as you said at the start of this conversation, is the number of countries that are deemed to be non-endemic, but it's also spreading in countries that are endemic. So while you're seeing a number of cases in countries such as Spain, Sweden, and the United Kingdom, which are and Portugal, non-endemic, you are also seeing it in countries that are considered to be endemic, such as, concerningly for us, the Democratic Republic of the Congo.
Yeah, so you raised 2 points there. I think I agree with you that there's circulation of viruses that are zoonotics, and they certainly are endemic in those particular countries. So interestingly enough, we had a case of Lassa fever imported into this country. So yes, there are those particular routes that could certainly happen, as has happened in the case of Lassa fever, for example. But we've not really had any identified cases, as far as I'm aware, of monkeypox being transmitted or imported into South Africa. I think the likely route of importation at this particular juncture is really a consequence of the non-endemic countries having those particular numbers of cases and our close links and travel with those particular countries, possibly making it much more easier for importation to occur compared to, for example, importation from endemic countries. It's not to exclude it, but at this point, our focus will probably look at the non-endemic countries as the potential source of monkeypox were to arrive on our shores in South Africa.
Obviously, at the time when South African scientists detected the Omicron variant of COVID-19 and described it and disclosed it to the world, there was that unscientific and prejudiced reaction by a number of countries, which was slammed far and wide. You don't expect that there'll be a need for any kind of, even if it's not that extreme, any kind of restriction that may need to be imposed should, cases be detected closer to South Africa, or will that conversation even arise around restrictions of movement of people?
Yeah, so my sense again is that it's very difficult to control the spread of viruses. You can certainly try the lockdowns, but these are really unsuccessful, and I would not recommend that even be considered. And I don't think it is being considered, even in countries where these non-endemic cases are occurring. I think what is going to be key here is really the early identification, because we may well miss cases, but it's really the early identification and isolation of cases, and then really doing a good workup in terms of contact tracing. I think those are going to be the key areas for us to really try and really control the spread in terms of the virus. So the only real restrictions are really around people who've actually had or do have been diagnosed with the pox virus.
And Prof, I am completely out of time, so I wanted to throw in a question around the COVID-19 situation. We are reporting, I think the positivity rate from this evening, if I'm not mistaken, I stand to be corrected, stood at about 13% thereabouts. And it does fluctuate, so it's kind of hard to keep up with. I'm just wondering about what purpose tracking the numbers still serves at this point, where community spread is something that is so, well established, such that it is endemic in our communities. I don't know if my question makes sense. That just tell me about what the purpose of the continued tracking and daily reporting on this, on the numbers continues to be, in a situation where it has become endemic in our communities.
Absolutely. I think we've been mulling this particular point around monitoring trends actually from the very outset, because the nature and extent of our testing has always been a bit of a challenge for us. But in particular, now that we've reached this point where there's a marked uncoupling of cases versus, for example, hospitalizations and deaths, really suggests that although we may have a large number of infections, we still consider that important, but I really think that the focus has changed away from those particular numbers. I think they can inform some of our approaches to what levels of care we actually require, but it's really around what the trends are in terms of hospitalizations and deaths that will already inform policy. So while the trends are somewhat useful, I think the major focus is around what's actually happening in our hospitals in terms of the severity of disease. I think that's going to be key for us.
Yeah. All right. I've got to thank you for your time. And I also suppose, Prof, that if we were to take it off the agenda altogether, there's a danger there that people, could fall into a false sense of security of thinking that we are in the clear, that there's no longer a virus that is spreading in the country. Thank you for your time this evening. That's NICD Executive Director, Professor Adrian Puren, joining me there talking about monkeypox, but also touching on the situation around COVID-19 and the continued vigilance and reporting on that virus.